Tonight, ABC57 continues our investigative series called The Cost of COVID-19. The final part of our series takes a closer look at the unseen costs in children.
Uncertainty really underlies anxiety, just normal. And the more you can tolerate uncertainty, the better you are.
Mary Alvord has been a licensed psychologist for over 40 years, working directly with local kids and families. I wanted to know more about how the coronavirus pandemic is affecting children. She says while it's pretty common knowledge that kids respond better to the virus physically compared to adults, she is still seeing increased mental health issues. The issues started with kids worrying about older people in their families, like grandma and grandpa.
Anxiety was like, what about my grandparents? Are they going to die? Are they going to sick?
But as time went on,
it's not just our grandparents. It could be our parents. It could even be us.
And it's not just a fear of death. Between parents working from home, kids learning from home, and all the changes that come with it, it's also a fear of uncertainty.
And the younger they are, the less they truly understand, and the more there's room for misinterpretations. We know from previous research that often parents are not as aware of how much their own stress really impacts their children.
And Alvord tells me if families aren't openly talking about hardships at home, that leaves their kids guessing.
And I'm not implying that parents should share all the details of the difficulties, but if they are struggling, they need to let the kids know that these are challenging times.
One way Alvord believes your kids could feel more comfortable is if you spend more time together as a family and really pay attention to how everyone is coping with this pandemic together.
That's sort of looking at yourself and your lifestyle. How are you coping? Because if parents cope better, they're actually modeling for their kids how to cope better. It's not just what we say, it's really more what we do.
Sadly, not all of Michiana's children can rely on their families for support.
There's definitely been a heightened need for kids who are needing high-end care.
Sean McCrindle is the Chief Operating Officer at Basher Children's Home, a nonprofit child welfare agency. He tells me they've seen more and more kids in need of residential care during the pandemic.
This is one of the most dangerous times because there aren't people watching as much as they used to. There aren't as many connections, and so things can stay behind the scenes much more. So while we haven't seen a huge increase on some of the front-end services, we have on the higher-end services and expect to see that continue for the next several months.
He believes that increase can be contributed to a lot of places closing their doors or providing limited support during this pandemic. Experts say when it comes to the pandemic, many people have to overcome that re-traumatization that comes along with it. But McCrindle tells me the situation is tougher with kids because most of the time kids can't comprehend how they feel.
It won't be until later that they start to have more significant issues related to it.
This is going to impact kids. I think we will move beyond this because I think we have a will to do everything we can to help kids, but it's not going to be easy.
Deborah Domini's been an Elkhart County judge for nearly 20 years now, hearing all juvenile cases.
I address needs of children on a daily basis.
Domini tells me these kids have all suffered trauma and they're all acting out in one way or another. Even still, she says there has been no increase in juvenile crime and no big uptick in the number of abuse and neglect cases.
I'm not surprised that there's not an increase in crime because I do think people are staying home.
And there hasn't been an increase in runaways either.
I do think people are scared. I am surprised that we are not seeing an increase in abuse and neglect cases.
Domini hopes that as Michiana moves past this pandemic, we can concentrate our efforts on helping the kids still affected.
I think we're all learning as we go. I can't propose a solution. All that I can propose is we try anything and everything that might work because these kids' needs aren't waiting.
Everyone I talked with believes it's too early to diagnose any permanent problems left behind after this pandemic.
We don't know how this period of time is going to impact the children that are growing up through, but we do know that anything that impacts kids during their formative years will have long-lasting impact.
But the experts all agreed that you shouldn't be shy about needing help.
Because helping and getting help also makes us more resilient, as well as being optimistic and knowing that this is not going to go on forever. It's much longer than we would have liked, but it's not forever.
Even if you're struggling a little bit through it, as most people are, that's a normal response to really abnormal circumstances. And it's okay to reach out and it's okay to get help. It doesn't make you weak, it makes you strong.
Mary Alvord, the psychologist I spoke with, also believes if we teach resilience and optimism, we'll be one step closer to bouncing back. And here at ABC57, we are trying to help solve the tough problems impacting your life. So if you have a story you want investigated, please send me an email at 57investigates@abc57.com or fill out the form on our website to submit a tip.